So Graves' disease is an autoimmune disorder in which the body makes antibodies against parts of the thyroid, but instead of destroying the thyroid, these antibodies make the thyroid overactive. Having said that, about 5 to 10% of people will not have measurable antibodies in their blood. When that is the case, there are other ways to determine if somebody has Graves' disease. One is to do a radioactive iodine uptake, which is a test that is done in radiology. They give you a capsule of iodine and they measure how much iodine is taken up by the thyroid. People with Graves' disease will usually have a high uptake. Sometimes it can be within the normal range, but it should never be low. If a scan is simultaneously done, they will see that the whole thyroid will take up iodine. It is not always necessary to do that test, and sometimes it's just not possible to do that test. What I do is I look at the patient's history. If someone had normal thyroid function recently and all of a sudden has evidence of hyperthyroidism, then I have to entertain the possibility of thyroiditis, which is inflammation of the thyroid. If, on the other hand, the labs have been abnormal for months or even years, that it's unlikely that it's inflammation and more likely that it's Graves'. If someone has a palpable nodule, if there is a nodule that you can feel, then I do feel that it's necessary to do the radioactive iodine uptake and scan, more for the scan part, because there's two possibilities. Either someone has Graves' disease and a non-functioning nodule, and you need to treat those things as two separate entities. You treat the hyperthyroidism, and depending on the size of the nodule, that may require biopsy, or the patient may have a functioning or a hot nodule, in which case it generally doesn't require biopsy and you would just treat the hyperthyroidism per se. Sometimes when it's not clear-cut what the cause of the hyperthyroidism is, and for whatever reason we cannot do the radioactive iodine uptake, sometimes I will empirically treat people as if they have Graves' disease and then keep an eye on their thyroid hormone levels and try to taper them off if we can.